So I'm Dawn Martin Hill. I'm from Six Nations. I live there. I'm emeritus at McMaster University. I continue to do research, hold grants with the Global Climate Change Center of Transboundary Waters, CLARS, which is an international resilience water team led by McMaster. There's also University of Michigan and Cornwall that we work with. So this was Global Water Futures work. Primarily what it did, it has allowed us to figure out what the community of Six Nations wanted. That is the way you do research in community or Indigenous knowledge, is you are able to have meetings. So I went to the water treatment plant, spoke with those guys. I went to all the different stakeholders, health services, and they created basically a research team. Part of those research teams were traditional ecological knowledge, which I'm the lead of, but we had a biology team, we had engineers doing sensors, as well as chemical breakdowns of what's in our wells. We had earth sciences working with us doing climate change modeling for Six Nations. But this is our tech team, and we rely heavily on traditional knowledge to guide what we do, the questions we ask, and they would work with the engineers and the scientists saying, this is where we need you to look, this is where we know there's a problem, and that's just place-based knowledge over time, knowing what they feel is contaminated and what is concerning them. The main things they ask for out of our team, and there's 8 teams, I can't go over all of them, but there's quite a few teams that we put together with different grants, and all of those teams, they wanted groundwater. They identified groundwater is the most precious water. We would go over the names that we have for water. They don't really translate to water. They translate into things. It's a verb-based language, so it's like this is something you cherish. So water doesn't quite cut it when we try to express these ideas or worldviews in English. It completely takes away the understanding that our people have of water. I have not, and I have written many grants with some of the leading experts in Canada on groundwater and been able to get a study on our groundwater at Six Nations. I don't know why. We partnered with multiple universities, hydrogeologists, but Christine here was successful in helping us get one of those things accomplished, and I'm hoping we do so. Now, Six Nations has a number of treaties. I'm not going to go over a lot of this, just like we have a limited time, and I know you're all hungry. Part of the other piece is the elders wanted our community people trained. So we would have community navigators. You were able to meet one yesterday who's now in charge of the land-based healing. She was trained by Indigenous. We've sent them to the UN. We sent them through training on water governance. So we're trying to make sure that our community members can take up the work that we're doing much later, as well as creating a Haudenosaunee Research Institute, which we found is desperately needed to continue this work. So while we have multiple teams, this was designed by the community with professors from McMaster, Waterloo, Wilfrid Laurier, and many others who are all phenomenal. This is kind of the way I set it up. Just so you know, this is how Indigenous knowledge works. People hear holistic and they think it's really simple, 4 quadrants, and here we go. Indigenous knowledge is exhaustingly difficult and complex. It's much harder than just saying, I just want to know what's in the water in the wells. It's so diverse, and they have to be integrated and interlocked, so we would have to wait for the ecosystem assessment results to be done and some of the water results to be done to then design the health intervention. So it was very much integrated all the way through. And then I would have to match each team with stakeholders in the community. For example, they wanted to know how maternal health and pre-maternal health was impacted by lack of access to clean water. So we worked with the birthing center, collected 40 interviews from new moms, and really were stunned by what the results were. And then we would feed those results into policy. So we would take the information and then we would meet and sit with health services leads, and they would say, okay, this is what we need to pay attention to. We had no idea. So when COVID happened, it really, really helped to have the data. The other one obviously is data sovereignty. So most of the data we collected and want to continue to collect on water monitoring, but as well as health monitoring, training and capacity building, is we want to be able to make sure that that data is in community and accessible. So one of the things IK does is it translates some of this very difficult science that our people are very uncomfortable with into story, into a way that resonates with community so that we can go talk to the schools. We do have a youth lead. She's gone around to all the schools. And the kids, I would say, are most interested in water. But particularly, we want to really know how our groundwater is doing. And we want sensors designed. I didn't quite get that done. So this is still how the team operates. We have quadrants and we meet periodically. I'm not going to go into any of that. But just to give you an idea of how important looking at water and health is, which public health started because of contaminated water in Canada. And somehow over the years, they seem to have, drifted apart and siloed. And for our community, they very much work together. So when we found these results, and these were a number of other results that came in from other studies with health services, where mental health was significantly impacted more than anything else on the lack of access to clean water, which honestly we had no idea. So now policy can address this a bit better and assist particularly with new moms who worry about running out of water 10 times a day. And I didn't know that, and I lived there. So we want to get longitudinal data together, but also the people were concerned about food. And if we're growing food and our water is contaminated, is our soil contaminated? So then is the food contaminated? So they look at these interconnected, interlocked ideas. When Mark Servos, who has done wonderful work with our people at Six Nations, did an assessment of all the fish in the Grand River, as well as in our creeks, one, we didn't know a lot of these invasive species were there. But what we do is we take that data, and then I go assemble 6 language speakers, elders, Mohawk, Cayuga, Oneida, Onondaga. We pull them together and say, what do we know about these fish? How can we support the health and bring back our sustenance? So then they would translate, so all of Indigenous knowledge is in the language. So we don't just call a sturgeon a sturgeon. It has an entire characteristic. And we go by those characteristics and how we worked with them, how we had a relationship with them. It tells you everything you need to know. So without the language, you can't access Indigenous knowledge. And we had a water festival this summer with health services concerned about the high incidence of waterborne illnesses they were seeing. And we had an amazing turnout for the community to come out, and they got to go to all the different science stations, which we had 30. And they loved it. They want to do it again. And I'm like, okay, now I got to find more money. Seems to be what I do most. So we did the Mackenzie Creek because the elders wanted the creek looked at first before the river. They said Grand River Conservation Authority and other groups have some data, but there's little data on the creeks. And that's the one that is in people's backyards. And what we found is it's not good. I'm not going to go over the results, but let's just say having the kids do land-based learning, which is a big thing happening in Indigenous communities, going into a particular creek when there's more E. coli in there than there is water, not a good idea if the child has a cut. So we're very concerned about making sure our findings don't scare people, but that we work with them, A, to find a solution, and B, to just maybe encourage them to go somewhere else where it's a little bit healthier. So it's a very fine walk. We also do a ton of academic publications. We wanted to know about the fish, so that's one of the things we've been doing is collecting fish with our anglers and then testing the fish. And the first thing they wanted done was turtles. I can't go over all this data, but I will say that mercury was a big concern, and one of the shocking finds at Six Nations anyways, was that our turtle population is really healthy and doesn't have high incidence of contamination for mercury. So that was an interesting find, because the elders thought if the turtles are not doing well, humans are not going to be doing well. This was a very important, Dr. Karen Kidd, who's a biologist at McMaster. She provided her study with us, and one of the things we wanted to do when she went over this with us is we realized, I'm not supposed to tell everybody, but our people go off reserve because most of our land has been, you know, not ours, but we still hunt and fish where we always hunted and fished. And one of the places they fished, especially like a lot of people from our reserve go there to fish, it's what they've been doing for a long time, has some of the highest incidence of mercury. So getting this information to our fishermen, because what they do is they often donate their food to senior citizens' home, the elders. That's part of the, you can't sell fish. There's a whole protocol around bringing yourself some bad luck if you start making a commodity out of these things. But anyways, they give it away to people who need it. And we found, wow, this might not be a good idea. So this data becomes incredibly important to our community to make decisions on a daily basis in regards to water. The climate change study that Earth Sciences did with McMaster, Tariq Dean just published his third article. The modeling that he was doing was of the greatest interest to Six Nations, both the Band Council and the traditional government. So again, I was surprised because I thought, how do I translate this and not scare people? But they wanted to understand this, so I had to work long and hard with Tariq and others to say, how can we translate this back to the community in a way that isn't alarming, because we already have a high incidence of mental health concerns, especially around access to water, but also climate change seems to be on a lot of young people's minds. So we're very careful to not further bring anxiety, but also we need to make decisions, i.e. like we need to start planting earlier. We need to start adjusting things that we've done for a very long time because of the data that we found. And elders agreed with the data, so that was something we want to continue to do because it had big implications for our food system. Now this is where Rohini was going to take over, because she's at the University of Toronto in history, and she did a study on the Grand River, particularly around Amara, where the plants are that created things like Agent Orange before there was good policies in place. So I'm not going to cover her material. She was on her way. I hope everything is okay with her. We're now running think tanks because, yes, the grants end, but once you're in a community, I'm accountable daily to my community. And if I bring people into the community who upset or maybe do things that are upsetting, I'm going to pay for that. I got to fix it. So I'm very, very careful about doing training with the scientists that do come in, and often partnering them with what we call a community navigator, who kind of is their right arm, who goes around with them. I think yesterday Makasha took you to the site and you found some things. So, you know, having a community navigator is incredibly important for any research in community, because not only that, they're exposed to data and information where they never thought about a career in the sciences and engineering. And one of the first young men that we assigned to our engineering team went on into engineering at Western and Waterloo. So we know this is an important component for our people. Now we're creating pathway programs with McMaster, and also trying to create better curriculum that addresses Indigenous ways of knowing in engineering, but also in the natural sciences, by working together and co-creating courses. So I'm going to leave it there. I think we're at 15 minutes. I'm not going to finish. I'm worried about Rohini showing up at the last minute, but I'll leave it there. 15. Are we good? This is our community navigator who still works in community.
Thank you, Dawn.
So her research is incredible. I'm so lucky to have her on our team, and to have 3 postdocs. I have an engineer, Rohini from U of T in history, and Hillary, who's from U of T Health. And they're phenomenal. None of this would happen without them. So Nothing like putting you on the spot.
Hi, everyone. My apologies. I think our schedule was mixed up a bit. So I'm sure Dawn has given you a good overview of the kind of work we're doing. And we've recently partnered with Natural Resources Canada to do both a scientific study of the hydrogeology and put in some wells to better understand the aquifers and the groundwater on Six Nations and around. And so that is like a major part of the study that's going to take shape over the next year or 2 years. And to complement that, we're also doing historical social research about why the environmental conditions are the way that they are at Six Nations. So I'm going to be leading that historical work, which ties into previous research I've already done, and I'm continuing to build on about the Grand River. And this particular image is of a site actually very close to here in Elmira, which I'm sure many of you know have experienced a lot of water issues. They have contaminated wells, and they actually pipe in their water from Waterloo. And this is the consequence of, not singularly, but very much linked to the history of the chemical industry there, which has produced a range of really harsh chemicals throughout the 20th century, including military chemicals, including highly debated ones that became banned, like DDT and so on. So these are the kinds of things that have been going into the Grand River for a very long time through the process of industrialization, and we're trying to use both archival and community knowledge to build a community relevant history about the water and complement the scientific information and data that is produced about that. Yeah, and this is just the kind of information that can be retrieved from archival research of this kind. This is from a report that was done several decades ago that indicated species loss very early, and very little political or governmental action was taken for a long time. So yeah, this is just in conjunction with a lot of other work that we're doing at Six Nations, and one of the broader projects that we're working on is really forming a research institute that is really sovereign to Six Nations. It's based on both the priorities of the Haudenosaunee people. It integrates their philosophies. It integrates what are their research priorities and how research gets done, including collaborations and so on. So we've run a series of think tanks to develop that work, and yeah, our collaborations with various scientists come into that. So I think I'll leave it there, but thank you so much.
Thank you very much.